And so I went over a little bit as far as the drugs, the anti-inflammatories, topical anti-inflammatories, which are a great thing. This is really a beautiful type of solution, in my opinion, because a topical anti-inflammatory, you're basically able to take the GI system completely out of the equation. One of the biggest risk factors for any anti-inflammatories, oral anti-inflammatories, is GI. GI risk, peptic ulcer disease, colitis, gastritis, any of those things in the GI tract, esophagitis, reflux. And when you have a tendonitis or an arthritis of a joint that doesn't have a whole lot of soft tissue around it, rather than put it in orally and have it go throughout your system and have it have its impact on the GI system and the kidneys, use a topical. You can use a topical. It's very local. It does much better, much more effective with lower doses right over the tendon, right over the joint. Hormone replacement, as we were talking about with osteoporosis, estrogen replacement, thyroid replacement, Forteo. Forteo is that one I talked about, the once-a-day injection. Bisphosphonates. Bisphosphonates are an oral alternative, but they're not near as good as Forteo. And I'll go into a little bit of detail on that. Bisphosphonates, they increase your bone density, but the bone that it creates is not as resilient as natural bone, nor is it as resilient as the type of bone that Forteo builds. And the reason is you are replacing calcium with phosphate. And so it looks more dense when you do the scan. Actually, your numbers will end up looking better. But if you were to actually put that bone under stress and strain, it fails earlier than what normal natural bone does.